Hey everyone, welcome back to Autism Uprooted podcast series with BioNexus Health. I'm your host, Dr. Jodie A, Dashore, and today we will be traveling all the way to Pakistan and speaking with a physician mom who has agreed to share the journey of her son's recovery from autism spectrum disorder. He's well on his way. His progress has been spectacular, and I'm really happy that Dr. Pakisa has agreed to chronicle and share his journey with us today. So let's welcome Pakisa to today's podcast.
Welcome to the BioNexus Health podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie A. Dashore.
Dr. Pakisa, welcome to BioNexus podcast. So glad you're here.
Thank you. Thank you so much, Dr. Jodie. Pleasure is all mine. Thank you.
Good to see you smiling. And, right on that note, let's talk a little bit about your child's progress. How did you find BioNexus? What made you actually decide to go for the all-natural herbal protocol?
It's actually a very long story.
Okay.
Starting from my pregnancy and all the antenatal period, I didn't know that I had mold exposure during my antenatal period, and after that, after giving birth to Ahmad, we were trying biomedical treatment for like 2.5 years before reaching you, and before that, the conventional biomedicine was not helping him. It was not helpful for Ahmad.
Okay.
We were, he had multiple issues. Like, he was diagnosed at the age of 2.4 years with social communication disorder and borderline autism. But when he reached age 3, we got the lab tests done and everything, and there was high level of lead in his blood. Chelation done. We got chelation with calcium EDTA at that point of time for like one whole year. But and I just tried biomedicine for like in total for 2.5 conventional biomedical treatment for like 2.5 years. Once I was, getting him chelated with calcium EDTA, everything was going all right, but I couldn't see a much marked improvement in his, behaviors or his cognition, especially. After few rounds of chelation, there was speech. I must say there was his speech came, but that was not coherent, and it was not in sentences and not in phrases. One word vocabulary was there. After a while, there was a plateau. His gut health was deteriorated at that time like anything. Initially, at the age of 2 years, he had constipation, and then after chelation, and there was, I think, the gut dysbiosis worsened. At the age of 3 years, he had severe diarrhea with literally foul-smelling stools and undigested food particles, and his bowel habits were very disturbed. His eating, he was very picky eater at that time, and he had aversion with every medicine at that point of time.
Oh.
And actually, I'm a very patient by nature. Like, I just give a certain amount of time to, certain type of treatment. So right. I decided to stick on to it and give it a try for a while. So I continued my journey with chelation and everything. But but then after like 1 to 1.5 year, I heard many moms in my community, advocating like naturopathy and herbal medicines. And I thought, why shouldn't I give it a try? Because, Mother Nature has cure to everything. We just believe in deep inside, we believe that. But, as a doctor and as, general practitioner, we just stick to allopathy and everything. So I wanted to give it a try. Desperately, I wanted to give it a try. So, and before our appointment, in December 2020, my son Ahmad had an episode of right leg limp. And you remember that I was late in delivering the history to you as well, because I was constantly rushing to hospital for his MRI and his X-ray and then his orthopedics. He just gave diagnosis of it could be due to excessive chelation, which led to bone demineralization, or it could have been due to Perthes disease, avascular necrosis, which you figured out later that it could be due to Lyme disease.
Correct.
And that was the high point. And fortunately, after a few days, I had consultation with you regarding Ahmad, and literally by that time till now, there's no going back. Like I must say that it's a very small step ahead, but it's never going back. Like it's in ascending order, never descending.
Right.
So
right. If I may. So, just so that people understand, I'd like to recap just a little bit. So you started chelation with him pretty early on, and you saw some benefit. Words did come in, but it was gibberish. But there was some verbal. I remember that from my son Brian's journey as well. And then after that, you found a worsening of his gut health. But
yes.
Right? Yeah. And then you heard about BioNexus, a naturopathic herbal approach. And yes, I do remember you mentioning his Ahmad's right leg, because we had that issue with Brian's left leg paralysis, excruciating pain in his entire pelvis. And, he ended up in a wheelchair because of that. And I remember what I had explained to you was, we saw 19 specialists actually, Pakisa, and including pediatric oncologist, and who thankfully gave us the all clear. We did have numerous X-rays. Unfortunately, I wish I had known better, but we had numerous X-rays just to rule out Perthes disease, kind of monitor, but it wasn't Perthes disease. Then as a diagnosis of exclusion, we were given the CRMO diagnosis, chronic relapsing multifocal osteomyelitis, and turns out, because the entire pelvis, upon imaging, we did a 3.5 Tesla MRI on him to get a good visual, and we saw a lot of exudate, a lot of inflammation, pus, fibrosis in the entire pelvis. His hip range of motion on both sides was almost negligible, excruciatingly painful at that time. So Ahmad's case did remind me of Brian. So we started him on a customized. No, actually, first we did lots of lab tests, right?
Yes. And that showed a lot of mycotoxins and glyphosate toxicity. And that was like, literally, it was more than 95 percentile, the glyphosate toxicity.
Yes.
Yeah, too high. And other lab testing was also very bad. I must say that his whole health was not improved even after chelation. I don't think so that it had helped him. I think it was I was giving him too much, but that was in haphazard fashion. The best thing about joining you and continuing with you was that everything was very much planned, and you always think of giving everything at a certain time, it wasn't like chelation at the first spot and then you are going to manage the gut. Like gut was managed at first, all the nutrition part, and then I remember anti-inflammatory and organ support, and then antimicrobials, and I was very smooth, and that was very easy for us, for as a parent, to continue that journey and to continue the medication like that.
Yes, so it made sense that it was,
Yes.
structured step by step. Yeah, I know that is something that is so important, that you first support the body so that whatever comes later, like, when we start the antimicrobials to be able to handle the infections. Now, these are herbal antimicrobials, and one thing one has to understand, when both you and I both have an allopathic background, and it's important to understand that when you do herbals, they go deeper and further than allopathic antibiotics or medications. Herbals can go intracellular, and you can certainly have Herxheimer or die-off reactions that can be seen. So to minimize those, it's important to go step by step. Now, the other thing that I find important is, that's why I ran so many labs for you, was that one has to customize the protocol to the patient, right? So we are not doing too much or too little, because, cookie cutter protocols might end up like, for example, there's nothing wrong with chelation. It's a beautiful protocol, but, sometimes you can see side effects like you saw, possible bone demineralization because chelation was a little bit too much, or maybe slightly higher dose than what should have been. So I actually believe that customization is very important, right? What do you think?
Yes, definitely. I'm a sufferer of haphazard protocols, like for 2.5 years. And I must say that my life is at ease right now. Like, I don't have to worry when I have to increase or decrease the protocol. I just don't have to bug you all the time, because you have already given me such a smooth protocol that I am very easy to use. I am a working mom right now, but all my, cocktails you have told us to make, and everything is so organized throughout the day that I have nothing to worry about. And it's really very easy.
It's wonderful. Yes, it's very important to make the lives of mothers easier, because oftentimes there are other children. Oftentimes, you have a job. You are a medical professional, so obviously, being on call, etc. It's like it's not easy. So, what progress in what areas have you seen? If you can cover like language, cognitive, growth, health and wellness, immune system strength, sleep, gut health, because I know he's improved in all those. So if you can, please elaborate.
Yes. From past 4 to 5 months, I must say that his speech has improved a lot. Like, he is now saying in phrases, short phrases. Like, if he wants something, like initially he has just learned by heart. What is your name? My name is Ahmad. Like, he has learned, he would have learned it by heart. But now at this point of time, he has understood many concepts. His cognition has improved a lot. Like, if he needs something, he tries to man, he tries to point, he tries to communicate verbally, most importantly. Like, he wants to go to sleep, I want to sleep, I want water, like short phrases, but they are meaningful. Actually, that is more happier for me, much a sigh of relief for me right now. And now his fine motor skills have improved a lot. Like, I have noticed that, like, his fine motor skills, like in holding the spoon, writing with the pencil, that has improved a lot. Initially, I had to struggle a lot with him for that. And after the fine motor skills, his speech skills, his overall health has also gotten better. Like, his sleep issues were worse. It was really hard for him, for us to make him to, put him to sleep. And in the middle of night, he used to be up and awake and like crying and laughing for no reason, like definitely parasitic infestation and everything. He was like that. But now he is having a good night's sleep all night long, and his eating habits are improved. Like he was very picky eater. Like he was aversive towards medicines and certain foods. Now he is, and a good thing about your protocol, the minute I started your protocol, he just instantly, I don't know how, but he instantly started taking that medicine like without any aversion. Like not even a single time he had aversion with your protocol medicines. Like that was a surprise for me. And still now he is not having any aversion with the medicine. He is not picky. Some foods are his favorite, but whatever I feed him, he just eats like a good child. He doesn't throw tantrums that I don't want to eat, or this or that. That also improved. His bowel habits are improved as well. Like now his stool consistency and his he's pooping for once or twice a day, like mostly once a day, and everything is fine now, and it's much managed now.
Okay. Okay. Can you tell us how old Ahmad is, and how is his leg issue doing now?
No, not after that. That was a single episode, and now that happened when he was 4 years old, 4.5 years old, when we had a meeting with you for first time. Now he
Yes.
is 5 and about to be 6 years old. Like we are on protocol for 13 months, 13 to 14 months.
Yes.
There's no leg limp, and I didn't check the x-ray. I didn't need to, but there is no leg limp or any pain, any excruciating pain is in his pelvis or leg or in discomfort, nothing.
So overall, he must be a pretty happy 5-year-old overall.
Yeah. Yes.
Very nice. It's such a heartwarming story. Ahmed's story, when I first met you, his medical issues, like I said, had really touched my heart, because it reminded me so much of my own son. So I'm really glad to see him thriving. One really cool thing about you, Pakisa, is that you grow your own fruits and vegetables and grains, right? The glyphosate toxin, which is a kidney toxin, immune and brain toxin, and also quite detrimental to the liver. Once you saw that it was in the 95th percentile for Ahmad, right? I think you were like, that's it, not happening anymore.
Yeah,
that was very cool what you did. Fantastic.
Yeah. Actually, we grew our own medicines or our own vegetables and, fruits and grains from that point of time, especially when the glyphosate came, really high. And until now, we have our own land, in Pakistan, in India. I know people have a lot of land, but we never utilized it for the purpose of growing the crops or growing our own vegetables. We used to we never used for that purpose. But after this episode, and after all, we went all natural and herbal, we started to go as organic as possible. And for that, we grew our own vegetables. Now everything is homegrown. Most of the time it's homegrown, and we try to make everything clean and less contaminated as possible. Yeah.
Yes, that was another another similarity, and I'm glad you were able to utilize that, because yes, on my farm we grow all the medicines, fruits, etc., of vegetables. Like we grow as much food as we can here, depending on the grow zones, because I'm in the cold Northeast environment, and even with my herbal farms. So depending on the grow zones, we grow as much as possible of everything that we can, and neighborhood farmers are also, we are in, the farm is in Amish country, so we have beautiful organic farms all around. So that has also been quite beneficial. Say we need additional beeswax from, because I have about 16 beehives, depending on the year, between 12 to 16 beehives, so we get our own honey, our own beeswax, etc. But sometimes, neighbors chip in as well with whatever they grow. So that's like, I mean, the entire Amish country here in the US, in Lancaster, Pennsylvania, is completely in touch with Mother Nature. So that has been a big blessing for us as well,
Yeah.
Good. Okay, awesome. So your life must have become easier, right? Family life must have become easier now that Ahmad is doing well. He also goes for therapies, if I'm not mistaken, right?
Yeah, he has taken therapies like since he was 2.5 years, like since he got diagnosis, and that is also a separate journey, and that's a very long and tiring journey for me, and I must say that alone therapies would not have worked if I would never have used your medicine or your this herbal protocol. Both worked really coherently and in a very beautiful harmony. Um, for the therapies, I used to take him, when he was 2.5 years old, I used to take him to a city nearby me. Like it's not that near. It's like it took me 3 hours drive.
Oh, wow.
To, yeah, but the therapy was available over there. And then afterwards, I had to stay in that city for a while as well, due to Ahmad's therapies. Like for 1 year, I stayed in Lahore to get his therapy, and then I moved back in COVID, and in during that period, I also started the naturopathic medicine and herbal protocol, and since then I have like for 7 to 8 months, I gave him home sessions. Like I took his sessions, ABA, speech, and occupational therapy. I just got my registered behavior technician training, RBT training, and I gave him therapies myself. And from past 7 to 8 months, like about to be 1 year, we just opened a center in our city. Like it's known as Basis, and we are just very happy to provide services and therapies to our kids over there. And it's like ABA, speech, and OT. But I think alone the therapies won't work if you have not healed the child
Right.
from inner. And now good news is that he's going to school as well. He's going to a mainstream school from past 3 months.
Oh, that is absolutely the best news ever. I love it. So he's been mainstreamed. That wasn't so bad. I mean, with 14 months of herbal protocol, with seeing steady major improvements, and now he's mainstream. Oh, it's many blessings to him. Wonderful, wonderful. I'm so happy. Yeah, one thing that you must have noticed on the BioNexus herbal protocol that I noticed, and many parents report this as well, that all through seasonal coughs and colds, ups and downs, nowadays through COVID, the gains are maintained.
Yes.
And the immune system is actually giving a really good response. Many kids whose families go through COVID, the children on the full herbal protocol are doing just fine.
Yes. Like it's just a normal cough or flu for them. Like it's not like a COVID. Like it's just like a normal flu. Earlier for 1 year he didn't get fever, but he was fatigued and feverish every 15 days. Like every fortnight he was having a body fatigue and like fever. Yeah. But since we started the protocol, it never happened like that. Yeah.
It is absolutely amazing what proper, customized, targeted herbal medicine can do for you. It's just, I'm so glad. I'm so happy for Ahmad. And I'm happy for you as well, from one mother to another, from one autism mom to another.
Yes.
Yeah, good.
Thank you so much, Dr. Jodie. Thank you so much.
Absolutely. It's been an honor and a privilege to be able to help children in so many different countries. I think it is more than 73 countries now. It's just been phenomenal. Yeah.
Good.
So, now that you mentioned you have a therapy center as well. Now, as you may know, I'm also neurosensory integration certified, right, as part of my doctorate. And, and we have also discussed the specific regions in the gray matter and white matter that are involved with underlying tick-borne infections, and not just tick-borne, vector-borne infections, as well as mycotoxins, right? So there are specific areas, there's the amygdala, the basal ganglia. There is specific regions in the occipital lobe that are involved. Now, customized sensory integration program for children exposed to tick-borne infections like Lyme disease, etc., as well as mycotoxin exposure, mold exposure. A customized sensory integration protocol works really well. Instead of just using a general OT approach or a general, SPD approach, if we can customize this, I'm actually planning on coming up with a program for families who are doing therapy and for therapy professionals to be trained in how to do targeted sensory integration as well as OT protocols, because when training a child in fine motor, there are specific things, that is, not everything is upper motor neuron, not everything is lower motor neuron. You have to know when to work with the child on fine motor, gross motor skills, depending on what region of the brain might be involved. Basal ganglia, as you know, are involved in voluntary and involuntary movements as well. So I think the next revolutionary step for therapies in autism would be to customize the therapies to the child.
That would be amazing. I think we should all take lessons from you in that regard. And I must say that it would also be, as organized as your protocols. Like it would be also step by step.
Yes, it will be. Thank you for that. Yes, because that is the way to keep things organized, structured, and easy for the administering professional as well as for the child as well. And then you'll see the biggest bang for your buck, because many parents spend a lot of resources on therapies, and when they know that the therapies, first of all, when they know that the director of the therapy place knows what is actually going on in the child's brain and is able to tailor the protocol, not only based on general sensory integration principles, but based on specific scientific evidence-based information that is available to what kind of gray matter and white matter damage is seen with the underlying issues in children on the spectrum. Yes, so that is going to be the future, I think, of therapies for autism.
Yes, definitely. Specifically targeting those areas of brain would be much helpful. Yeah.
Right. Yes. Yeah. That brings us to the close of this episode of Autism Uprooted. I hope it has been helpful, inspirational, and educational as well. I think it's pretty cool how Pakisa's family, grows their own organic fruits, vegetables, even grains. That is just so amazing. I think she is such an amazing person, physician, mom. And I'm so glad we had the opportunity to hear her side of the story. So I'm happy that you were able to join me here today, and I look forward to seeing you at the next episode. Bye for now. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.